Hello, welcome to Agni Nursing Academy. So in this session, we'll discuss some important MCQs for the all upcoming examination. So we'll discuss some OBC important MCQs in this class. Understood? So first question we are displaying here: a patient who is known as a case of bronchial asthma. Understood? And develops the PPH. Here the question is related to bronchial asthma and she develops the PPH. Which drug should be avoided in this case? Understood? So you are seeing here the question is related to bronchial asthma. Understood? And she develops the PPH, that is postpartum hemorrhage. Understood? And PPH, everyone knows that more than 500 ml blood loss in the vaginal delivery and more than 1000 ml blood loss in the case of the cesarean section. Understood? So this we will call it as the PPH, that is postpartum hemorrhage. So to reduce this one, we will use the various types of the drugs. That is, we can see here treatment for this PPH. We will use some drugs. That is, first preference always goes to the oxytocin. Understood? So right here, oxytocin is the always drug of choice or preference, first preference for the PPH. And if the oxytocin is not work in that case, means, so then we need to go for the ergometrin. Understood? So we need to go for the ergometrin is the second option. If ergometrin also not worked, means, so then we need to go for the carboprost. Understood? So again we will tell, if oxytocin, ergometrin and carboprost, these three drugs not worked, means again we need to go for the surgical intervention. Understood? We need to go for the surgical intervention. Yes, we all know that every drug has the advantages and disadvantages. So here you can see, so this ergometrin is contraindicated in the cases of the preeclampsia or the hypertension. Understood? So right here, preeclampsia or hypertension cases, we can't provide the ergometrin as a in the cases of the PPH. Understood? And this carboprost, so where, sir, this carboprost is contraindicated in the cases of the bronchial asthma. So right here, bronchial asthma. Why, sir, this carboprost is what happens means, so this will cause the bronchial contraction. So right here, bronchial contraction, sorry, bronchial constriction, not a contraction, and it will lead to the bronchospasm. Understood? So it will affect this female. So that's why we can't provide the carboprost in the cases of the bronchial asthma and ergometrin in the cases of the preeclampsia. So here we can see the options here. Option A is the oxytocin. Yes, we can provide in the cases of the bronchial asthma. Yes, option B is the carboprost. Yes, so this we can't provide in the cases of this bronchial asthma. Understood? Yes, option C also we can see. Option C is the mifepristone. Yes, mifepristone is the drug. So when we will give means, so this one we will give in the cases of the medical termination of pregnancy, and should not in the cases of the PPH. Yes, this mifepristone is a 200 mg drug, so it will give for the cervical softening. Understood? In the previous classes also we have discussed about this mifepristone drug. Yes, you can see option C also wrong option. And ergometrin. Ergometrin also we can give in the cases of the asthma, but sorry, but not in the cases of the hypertension. Understood? So option B is the right one. And we'll move on to the next question. So you are seeing second question, that is, CA cervix lesion staging growth is extended to the pelvic side wall and hydronephrosis is present. What is the stage of tumor? So we all know that the parts of the pelvic organs, that is first one cervix. So here vagina, in the vagina, sorry, see. So in the vagina also, so external part, internal, here also cervix, that is this is the ectocervix and this is endocervix. So this cervix will join to the uterus, understood? So you can see here, and this is the pelvic wall. This lining is called as the pelvic wall. We will see now the staging of the CA cervix. The question is asking about the staging growth is extended to the pelvic side wall also, understood? So the CA is extend up to this wall, means this pelvic wall also, and hydronephrosis is present. What is the stage of tumor? So I will display the stages of the tumor here. You can see here the stage 1 confined to the cervix only, means the CA is only at the level of cervix. So you can see here this cervix only, CA is there in the stage 1, and stage 2 you can see here extends beyond the cervix but not the pelvic wall, and no hydronephrosis also there. And in the stage 3 we can see, in that also stage 3A and 3B we can see tumor involves the lower third of vagina but not the pelvic wall. So here you can see involvement of the CA is lower third of the vagina but not the pelvic wall. So again we'll see here, this is the lower third of the vagina, here also extended, lower third of the vagina here also extended but not in this pelvic wall, understood? So once again come here, in the stage 3B tumor extend to the pelvic wall and hydronephrosis is there or non-functioning kidney also there, understood? So here you can see option third B is the right answer for our question. So you can see here option 3B, that is hydronephrosis, and also it will involve to the pelvic wall and or non-functioning kidney. So this option D is the right answer for this question, understood? So this staging of the CA cervix is very important for the next upcoming examination, understood? Yes, please take a screenshot of this one. We'll move on to the next question. Okay, yes. So you can see here P1L1 woman delivered baby 8 hours before by vaginal delivery, means delivery happened by the vaginal delivery, and what is the earliest time to insert the IUCD? What is meaning of IUCD? Intrauterine contraceptive device, understood? Yes. Option A is the within 48 hour, and option B is the after 6 weeks. Option C is the after 3 months, and option D is the between 48 hours to 6 week. So we'll discuss the concept related to this IUCD insertion. So first one, post placental, means once soon after the placenta will be expelled from the uterine cavity, immediately we can insert the IUCD up to the 10 minutes, understood? So now down it is very important. within 10 minutes we need to insert, that is post placental, or also you can insert, that is postpartumly up to 48 hours. Understood? So post placentally within 10 minutes you can insert IUCD, or in the postpartum within 48 hours you can insert IUCD. And from the 48 hours to, so we can say here, from the 48 hours to 6 week of pregnancy, it is not safe. Understood? And it is contraindicated for the insertion of IUCD. So after 6 weeks we can insert. Understood? So here you can see 8 hours was happens, means, so this criteria will not come, within 10 minutes will not come, and postpartum within 48 hours, so this criteria will come, we can see here. Understood? So option A is the within 48 hours, option B is the within after 6 weeks, option C is the after 3 months, option D is the between 48 hours to 6 weeks. Understood? So here you can see option A is the correct answer for this question. Understood? So write carefully this one. This is important. Yes, we move on to the next question. So here you can see a woman with a 30 weeks of gestation presents with a calf pain, and means calf muscle and redness of the calf. A diagnosis of DVT, that is deep vein thrombosis, is present. Deep vein thrombosis is made. Which of the following would you use in the management of this patient? So here you can see the question is related to DVT, that is deep vein thrombosis happens. So calf pain also means, signs and symptoms is calf pain is there and the redness also there. Understood? To dissolve that thrombosis, to dissolve this thrombosis, we will give the drugs here. So we all know that anticoagulant drugs safest is warfarin. So these both we will use in majorly, that is LMWH, warfarin and low molecular weight heparin, right here, low molecular weight heparin. So these are the drugs mainly we will use for in the cases of the deep vein thrombosis. And sir, but here the question is asked related in the cases of the pregnant woman. So in the pregnant woman, warfarin is contraindicated, because why, sir? We will see here. Warfarin is contraindicated because of it will cause the teratogenicity. Understood? So here first in the cases of first trimester between the 6 to 12 weeks, what it will cause means warfarin embryopathy. Understood? So it will cause the warfarin embryopathy, also called fetal warfarin syndrome, also called as fetal warfarin syndrome. So in this disease we will see the nasal hypoplasia, means this nase will be flat. Understood? Flat nasal bridge we can see, and stepped epiphysis, bone deformity. So bone deformity also we will see in the cases of the paces, and growth restriction. Understood? Growth restriction will be there. And in the case, this is in the cases of the first trimester, and between the second and third trimester. So it can cause the fetal bleeding and intracranial hemorrhage and stillbirth. And in the cases of the near term, so risk of maternal and neonatal hemorrhage, because this is the anticoagulant therapy, so that's why bleeding chances is more in the cases of the maternal and neonatal, both for the mother and baby. So it is the very risk, so that purpose we can't provide this warfarin in the cases of pregnancy. Understood? So it will cause the fetal embryopathy and in the first trimester, and in the second and third trimester it will cause the fetal bleeding and intracranial hemorrhage, and it will cause the stillbirth. And in the cases of near term, it will cause the neonatal and maternal hemorrhage. So that's purpose we can't provide the warfarin. So definitely our answer goes to option C, that is low molecular weight heparin we will do. So this is very important. Yes, we'll move on to the next question. A pregnant woman presents with a history suggestive of the hyperthyroidism. So the question is related to hyperthyroidism, and with the 8 weeks of the pregnancy of the gestation, so drug of choice, the question is asked. Here you can see the question is related to hyperthyroidism. So related to this drug of choice, this question is related to drug of choice. So I will tell the drug of choice in the cases of the pregnancy. According to the trimester, we will provide this hyperthyroidism drugs. So in the cases of the first trimester and second and third trimester, we will discuss here. So in the cases of first trimester, PTU, so this is the PTU is the drug of choice. Understood? Prothiouracil is the drug of choice on the first trimester, and in the cases of the second and third trimester, this methimazole and carbimazole is the drug of choice. Methimazole and this carbimazole, these both we can use in the cases of the second and third trimester. Understood? So the here question is related to a pregnant woman presents with a history suggestive of the hyperthyroidism with a 8-week pregnancy of the gestation, that is POC means pregnancy of gestation, and the drug of choice is so always PTU. Understood? So option C is the correct answer for this question. So you can see here in the first trimester PTU is drug of choice, in the second and third trimester methimazole and carbimazole. Understood? So this is very important. So till now I have discussed the 5 questions of OBC important MCQs. So daily we will come with another important questions related to this OBC, just to stay connected with the Agni Nursing Academy, and also with this one. So Agni Nursing Academy will providing the test series. So test series in the our Agni Nursing Academy app. So please download the app. I have given the description link in the description box. So if you like the class, so please subscribe and please like button. And so this test series will be live from morning 6 a.m. and live up to the 6 p.m. Understood? And so daily result you will get from the All India rank in our all official WhatsApp and the Telegram channel. Understood? And up to NORCET mains, daily you will get one test. Understood? For the prelims also and mains also will get the one daily test. So please take up that use, and every Saturday we are giving the pre-test in our Agni Nursing Academy. So please use that one. Thank you, everyone. We'll come within the next class.